Okay, so our group did anorexia. So anorexia is an eating disorder that causes extremely low weight and a fear of gaining weight. People who struggle with anorexia may vomit or feel sick after eating. Anorexia is a strong desire to be skinny and not gain weight, which can lead to various medical conditions. Anorexia is categorized into two different subtypes: the receding type and the binge eating and purging type. The restricting type is when someone restricts their diet to the point of starvation, and binge eating is a pattern of distorted eating which consists of episodes of uncontrollable eating. There is also anorexia athletica, which refers to the disorder of athletes who engage in at least one unhealthy method of weight control. Unlike anorexia nervosa, anorexia athletica does not have as much to do with the body image as it does with performance.
All right, so some of the symptoms of anorexia are losing extreme amounts of weight, appetite loss, depression, sensitivity to cold, delayed puberty, fatigue, dizziness, compulsive behavior, and vomiting. How is anorexia diagnosed slash identified? Anorexia is not physically diagnosed as there aren't any lab tests that can identify it, but doctors may choose to do blood tests to make sure that the weight loss isn't harming any of your body's organs. It is identified when the patient's BMI is 15 or below, which is extremely low, and they have to be hospitalized. If you didn't know already, a BMI is your body mass index. It's calculated by taking the body mass and dividing it by the square of the body height.
Do genetics play a role? Genetics most definitely play a role in anorexia. Eating disorders run in families, and individuals who have a family member with anorexia are up to 11 times more likely to develop an eating disorder themselves.
Here are some of the risk factors. It can be through genetics, substance abuse, personality traits, past trauma, gender and age, participation in like specific activities, family factors, childhood obesity, and eating problems, psychological and emotional disorders, and weight concerns, dieting, and negative body image. And then some of the statistics are that anorexia is the most deadly disease with the highest mortality rate than any other mental illness. 1/3 of those with an eating disorder are men, and then 1 out of 5 anorexia deaths is by suicide. 50 through 80% of the risk for anorexia is genetic, and then over 70% of people who suffer with an eating disorder do not seek help. So to prevent anorexia, it's usually mainly in the mindset, but if you want to help somebody who is struggling with anorexia, tell them that being extremely thin isn't better. Put more importance on their personality than their looks. Encourage them to be more honest about their feelings and build their self-esteem. All of these suggestions may not work for everyone struggling with anorexia, but it may help or improve their condition a little. They should also be aware of the dangers of dieting. So they should probably go to a nutritionist or someone that can help their diet.
So the treatment is, when it comes to treating anorexia nervosa, there's many treatments that need to be involved in order for a full recovery to take place, such as having nutritional support, counseling, and behavior modification. Depending on how severe the illness is, the patient may be placed in an inpatient or outpatient unit. If family or friends is struggling with an ED, it is important to learn about this disorder and be caring but firm, remove potential stigma, and encourage them to seek professional help. Because anorexia is such a taboo illness to talk about, we as society need to spread the word and remind others how severe this illness truly is.
Anorexia can have an enormous impact on one's life. Between their mental and physical health, a lot can happen. From dropping all that weight drastically to being depressed and having suicidal thoughts, it takes a big toll on the human body. And if it's not treated, it could potentially lead to death. This affects schools and other communities because it can make other people susceptible to getting this disease by watching others with it. This affects us locally because it's people we may know in our community that need help. It affects us globally because there's about 8 million people in the world with an eating disorder. That's crazy.